Things that we're talking about here are not something happening in the future or happening somewhere else.
Canadians don't want less Medicare, they want more.
It's under attack. It's a very dangerous game that he's playing.
Really what this case is about is trying to keep costs up, is to legitimize greed.
They're not putting their money back in. They act in shameful ways.
Privatization, the money does not come back into the system. It goes into the corporations.
They really do have an impact on literally on life and death.
Cuts are deep and they're significant. If you think you're experiencing rationed Medicare right now, you haven't seen anything yet.
It's a program of cuts and privatization and destruction of Medicare.
People are feeling completely isolated. Their politicians aren't listening.
It's not just stupid deal, it's really corrupt.
We have to throw the whole lot of them out.
Unless we are willing to engage in civil disobedience, we're not going to get Medicare and a lot of our rights back.
There's a lot more to this that we need to learn.
If Canada had the guts to close off offshore tax havens and loopholes, we would save $185 billion. It's a no-brainer. We're dealing with an ideology here that doesn't listen to reason. They cannot have our country anymore. It's just absolutely time to take it back.
My name is Kathy Woodley, and I'm with the Comox Valley chapter of the Council of Canadians. I think this was a great event tonight. We had lots of people here, and my hope is that each of these people will go and talk to 5 more people about what they heard tonight, because to me, we've got several big problems around healthcare. The first is that, and maybe it's the largest one, is that most of the populace of Canada have no idea that this is happening and is going to get worse. And that's enormous because Canadians care about their health care system. And the other big problem to me is that we have bought the government's story, whether it's municipal or provincial or federal, that there isn't any money, that we're already spending as much as we can spend on health care. Well, policy is the government's job. If the government thinks it's important, they'll find the money.
Paul Moist, National President, Canadian Union of Public Employees, and this is about the 13th Town Hall meeting in different ridings across Canada, a partnership between the Council of Canadians and CUPE to draw attention to the federal retreat from funding Medicare. The Harper government imposed a new 10-year health accord, which over 10 years, between 2014 and 2024, will strip about $36 billion federal dollars out of Medicare. Tonight we're here in Courtenay, we're going to talk Medicare, we're going to talk pharmacare, and we're going to talk about retaking our country and building it from the ground up with public, universally accessible, comprehensive Medicare.
I'm Dr. Duncan Etches from Vancouver, very active in Canadian Doctors for Medicare. Still practicing, mainly looking after seniors at this point in my career. We're working with the BC Health Coalition, and one of our activities is working on supporting the provincial government in their defense of the lawsuit generated by Dr. Brian Day to declare the Canada Health Act unconstitutional. So what he wants to be able to do is bill as he sees fit, rather than within the constraints of the Canada Health Act.
My name is Maude Barlow, and I'm National Chairperson of the Council of Canadians, and we're a national, nonpartisan, nonprofit social and environmental justice movement in Canada. We have 72 activist chapters across the country, and we're fighting for a just society. 96% of Canadians do not want our public system privatized. It means that all of the principles of healthcare, particularly the thought that you can go anywhere in this country and have the right to good quality, accessible health care, will be gone. And with it will be gone the jewel in the crown of our social security system. Every generation has to fight for health care, and we're no exception. It's under attack here in Canada, by the way, and around the world. And we're going to fight for it, and we want people to fight for it with us.
So welcome everyone to this meeting on defending public health care. The things that we're talking about here are not something happening in the future or happening somewhere else. The 2 North Island hospitals are, as you know, a public-private partnership. And the evolution of public-private partnerships is quite quick. Aside from the profit that is taken out of healthcare, every dollar that goes to every lawyer and every shareholder of every corporation that's part of the consortium, that's a dollar that is not going to healthcare. Aside from that, the authority and the healthcare workers themselves lose more control and lose any sort of coherence amongst themselves to be able to provide healthcare. Our speakers are fighters, defenders of public health care. All of us are defenders of public health care. We want to have a conversation. So we would like to hear people's stories, and there's a space for questions as well.
Good evening, ladies and gentlemen. It's a great privilege to be here in Courtenay. Over 600 North Islanders have shown up to defend public Medicare for all Canadians, and I thank you from the bottom of my heart. The background to this debate is incredibly important. Medicare, as we know it, is Canada's #1 social program. In every poll, in every corner of Canada, across every demographic, the unbridled question with no suggestion, what is the #1 policy issue in our country? It's Medicare. Canadians worried about having access to public Medicare. Federal funding for Medicare, as many of you know, from day one, 50 cents of every Medicare dollar came from our federal taxes. The federal government 50 cents from the recipient province or territory. By the end of 2024, federal funding for Medicare will have fallen to 13 cents on the dollar. If you think you're experiencing rationed Medicare right now, with the austerity in this province as it is, you haven't seen anything yet. Expect much more. In 2011, December, in Victoria, the late Jim Flaherty, meeting with Canada's finance ministers, announced on his own a new 10-year healthcare funding arrangement. No negotiations, no talks with the provinces, no meeting between the Prime Minister and the premiers and territorial leaders, simply a unilateral, one offer, that's it, here's the new accord. Most Canadians, when we knock on their door and give them one of these pamphlets, they've not heard of this and they're not happy when they hear about it. But the federal government's retreat on funding is not the only story. Part of the last accord signed by Prime Minister Martin and the 10 provinces and 3 territorial leaders was discussions were to commence on a national drug coverage program, a national pharmaceutical program. Mr. Harper stopped those in 2006, meaning the federal government refused to attend any more meetings to talk about the possibility of what Tommy Douglas dreamed of, a national pharmacare program. They closed the Health Council of Canada. Mr. Harper defunded it, it's closed. The group responsible for monitoring the status of healthcare in our country. It's better to have no evidence in Canada when you want to take things away. Cut health care for veterans, cut refugee health coverage, refused to uphold the Canada Health Act protections for patients against user fees and extra billing. Dr. Etches will speak more about this. Walked away from discussions with the provinces that were supposed to occur out of the last accord to begin to discuss increased public home care and a long-term care strategy for an aging population. Downloaded responsibility for RCMP, veterans, and refugee health services onto the province. Closed or eliminated federal funding entirely from the National Council of Welfare, the Health Canada Library, the National Network on Environments and Women's Health, the National Aboriginal Health Organization. These are just the health-related agencies which have been eliminated. Harper unilateralism and ideology is transforming our country. Canadians deserve much, much more than the Harper Conservatives. Medicare represents for us our commitment to one another as citizens. It defines us in many respects as Canadians. Now, if we were at a union meeting, I would say, this is too quiet. So I'll test your vocal cords and see if we can make Mr. Harper hear us. If I say health care, you say we care. Health care! We care! He can't hear you. Healthcare. Healthcare. Together we can win this fight by speaking to each other as Canadians, by making sure anyone who knocks on your door asking for your vote has to tell you where they stand on funding Medicare. And you know what? We can complete Mr. Douglas's dream in 2015. We can take back our country. We can save Medicare.
The particular thing that I was going to talk about was the threat from a legal case that's how many have heard about the lawsuit of the Cambie Surgical Centre against the province? Yeah, okay, so it's well known, sure. What essentially they're asking for is to have the Canada Health Act declared unconstitutional. And the reason they want to do that is so that they can charge whatever they like for their services. That's not usually the way it's framed. It's usually framed as an issue of providing access to people on waiting lists. And so I want to talk about the waiting list thing first. Intuitively, you think, well, that's great. You know, if people are going to go to the private facilities and get their services there, then they'll be taken off the waiting list. The problem is there's a phenomenon called crowding out. If we had unlimited number of physicians and nurses and x-ray people, then it would be fine if people went somewhere else. But what happens now is the people who are providing the service in the public hospitals, when they go to a private facility, they're no longer available. So what actually happens is wait times get longer, not shorter. And it's seen now in Australia, where they introduce much more privatization, that their waiting lists in the public system have gotten longer. It's been seen in Quebec, following the Chowley case, which ruled that the province had a need to provide shorter waiting lists and the private system would be allowed to do that. Their waiting lists have actually increased. So it's not been an answer to have this alternate access to care that they offer to provide. If you look around BC, the longest wait lists we have are actually for orthopedic surgical services. That's the area where there is the most privatization. Another aspect of the court case is the vulnerability to large insurance companies coming into British Columbia to start providing care. Under NAFTA, if a service is being provided privately that was in the public system, that opens up the whole system to private care. And I think most of us have lots of stories about the outrageous behavior of some of the insurance companies in the US and the effect that has on patient care. I don't think we want to allow the opportunity for private insurance companies to be the ones which decide what kind of care we get. A couple of other things which I think are an important aspect of the case is our Medicare system provides a solidarity between rich and poor. That it doesn't matter what your income level is, we're all in the same boat. And this sense of community that we get with having a public system improves the social relationships across all classes of our communities and across our country. And I think this is an important aspect of Medicare that is so important to preserve for the long-term strength of our community and of our social fabric. The final thing I want to say along that line is that there's a moral problem here, I think. What this trial is asking for is to legitimize greed. And I think we need to put lots of resources into supporting the opponents of this case and to kind of put some limits on the greed that could develop as we had more privatized services. They could get paid the same as every other physician in BC. There's no limit on them getting normal fees. It's really they want it because of the large fees. The trial is expected to go for 20 to 26 weeks, something like that. And this is just going to be in the BC Supreme Court. It's very likely to go to an appeal court and very likely to go to the Supreme Court of Canada. So ultimately it's going to be enormously expensive. And so that's one of the things you can do to help maintain Medicare is to provide some financial support to those who are opposed to it. And if you Google BC Coalition, you'll get the information on where to donate. Thank you very much.
It's incredibly important if we're going to fight the Harper agenda, not just Stephen Harper, but the whole agenda. If we're going to defeat it, we're not going to do it alone. We're not going to do it in silos. We have to work across all sorts of levels, and particularly working people and civil society groups, social justice, environmental, First Nations. We have to come together and we have to say that they cannot have our country anymore. It's just absolutely time to take it back. We're not the only country in the world going through this. This struggle to keep healthcare public, accessible, universal, something that we can all depend on, as Duncan so beautifully put it, something that levels out whether you're rich or poor, it doesn't matter. This is the sense of community. So I look at us and I say, here we have it. We don't have to fight for it, we have it. And here we have a fight to stop a man named Stephen Harper, who has been absolutely committed to destroying public health care since he was way back with the National Citizens Coalition, way back. He has been saying, I don't like public health care, I want to privatize it, I want to give it to the provinces. 96% of Canadians are absolutely opposed to privatization of our health care services, and in fact, if anything, we want them expanded. So, and that includes people who vote Conservative. So not being stupid, and believe me, I do not believe Stephen Harper is stupid, not being stupid, what he has done is he's wrapped this in kind of language as being a reforming of the funding formula. And it's going to be put off till after the next election so that it doesn't become an issue in the election. And what is happening gets hidden for a lot of people unless it's right there as an election issue. It's just kind of noise in the background, and that's the importance of what we're trying to do here tonight. No matter where you live, no matter how much money you have, no matter how recently you came here or whether you're 10 generations in, you have the right to go anywhere in this country and be treated with dignity and have healthcare services that are fundamental to your human rights. What's happening in Canada, I have to tell you, is happening globally. I mean, I talked about some countries that are reversing it, but we are seeing huge increases in public-private partnerships in countries around the world. And now 139 developing countries have public-private partnerships in their infrastructure. And again, still being told by the World Bank, if you want funding, you have to go in this direction. We also get the pharmaceutical companies coming in, and at the same time that they're, quote, donating drugs, brand name drugs in a limited amount to the World Health Organization, they're fighting the countries in which they operate, they're fighting against them limiting patent rights because they don't want the generics coming to the fore. So when we look at these big policies that we're fighting here in Canada, we're fighting them globally as well, and they really do have an impact on literally on life and death. So what do we need and what have we got a right to? Well, I believe not only do we have a right to stand still here and not allow any further privatization or commodification of our healthcare system, we need to expand our healthcare system the way Tommy Douglas originally dreamed of it. We need a proper program of continuing care. We have a desperate need for good health care in First Nations. Again, this is very much a federal responsibility, and it sits right at the doorstep of the Harper government. And we need a national pharmacare plan. Very recently, a wonderful study that was done by Doctors for Medicare and the Canadian Federation of Nurses Union said that if we did bring in a national healthcare or pharmacare plan, that it would save Canadians $11 billion. So what are we doing instead? Well, the federal government is promoting and almost completed an agreement with Europe, a trade agreement called the Comprehensive Economic and Trade Agreement, which among many other bad things it does, is going to extend the patent rights of brand name pharmaceuticals to match the longer one in Europe. It's going to take 2 years longer for the generics to come to the market, which means that it's going to cost us perhaps as much as $1.5 billion a year. So here's our choice. We sign this deal with Europe. We are locked in. You'll never get your national pharmacare plan then. We pay $1.5 billion more, or we save by bringing in a national pharmacare plan. I mean, where it's a no-brainer. unless you're such an ideologue that whatever the corporations want is what you give them. And that is what we're dealing with. We're dealing with an ideology here that doesn't listen to reason. So we need to understand that not only are these changes being made, but Harper is bringing in free trade agreements that place a framework over our domestic right to make our own decisions. And by the way, how are we going to pay for what I just talked about, a pharmacare program, a First Nations continuing care and so on? Well, the pharmacare program, as I said, would save $11 billion. But Canadians for Tax Fairness also says that if Canada had the guts, and other countries are now pursuing this, if Canada had the guts to close off offshore tax havens and loopholes, we would save $185 billion. Well, there is money. If we have the courage to go after these corporate thieves or these corporate bandits who hide their money offshore and refuse to pay our taxes the way you and I have to pay them. But again, the Harper government has never seen a corporation or that it didn't like, or a corporate tax, any kind of corporate tax that it did like. And so the great social programs of the 60s have been challenged so dramatically by economic globalization, by this assault on fundamental democracy. And it is why people like Stephen Harper hate our Medicare system, and it's why we have to fight for it. So I just want to say tonight, let us promise each other to stand on guard for what our parents and grandparents and great-grandparents fought so hard for, that must not be let go on our watch. And I just want to say this to Stephen Harper. Come the next election, you are not going to be Prime Minister anymore, and you are not taking our healthcare system with you. Thank you.
It's the part where people tell their stories or pose questions to the panel.
My name is Victor Elkins, and I am the current president of the Hospital Employees Union. We know healthcare is affordable. We know we can do it, it's just proper management. But funding from the provinces has led this to the ideology of contracting out our members. We have seen our members being contracted out to the lowest bidder, Compass, Crothall, Aramark, Sodexo, the list is growing. We had lost 8,000 of our members to these contracted out member companies. They went from a decent wage, a living wage, down to some of them about $12 an hour. Some of our members lost over $10 an hour just trying to get these jobs back. It is a crying shame. There isn't the time out there to look after our seniors because we don't have enough staff who have been trained to be able to look after it. Because these big corporations want to just continually cut, downsize, and increase their profit margins. The only way to do that is by lowering the staff levels and lowering the wages. Privatization, the money does not come back into the system. It goes into the corporations. It's a fight we can't give up.
I wanted to talk about the privatization. Once you have private medical clinics, I think what follows is private health insurance. In the United States, people pay $600, $800, $1,200 a month to have their family covered. They want to make maximum profit and give their money to their shareholders. So I do have a story. A friend of mine had a nephew who was suffering from abdominal pain. He was only 25. His doctor went to the healthcare insurer and wanted him to have a colonoscopy. And they said, no, he's too young. You can't have a colonoscopy until you're 40. So he was dead by the time he was 28 of colon cancer. And it was all done so they could return more money to their stockholders. And I think that is the tremendous danger that we face.
I just learned another shocking information on CBC, I believe yesterday or 2 days ago, claiming that Canadian costs for typical pharmaceuticals in bulk are about double that of what US or Aussies pay. I guess reporters on CBC call that stupid deal that was made sometimes in past. I wouldn't call it typical, I would call it corruption. It's not just stupid deal, it's really corrupt. I think this calls for class action because we are being ripped this way of billions of dollars that are missing out of our system.
It's true, we pay more for the generics than are paid in other places. And there's a significant influence of the pharmaceutical industry. There's a very tragic story that I think you've probably heard about. The researcher who, 7 researchers in Victoria who were studying some of the drugs that we commonly use. And it looked like they were finding that a number of them were useless, or not nearly as useful as they were supposed to be. And when they were getting ready to publish that, they were all fired. Since they've been fired, they've taken the government to court, and they've been successful in findings of wrongful dismissal. So the whole thing was a bogus firing, and there's been nobody held responsible for that, neither in government or in the pharmaceutical industry that's been trying to exert its influence.
I went to the last Vancouver Coastal Health Board meeting, and one of the things that's clear is public-private partnerships are imposed by the provincial government under Partnerships BC. And it was interesting, Barb referred to Crothall. Well, 20 years ago, they hired Crothall at St. Paul's, and I can give you the whole story about what a disaster that was and how much it cost the hospital. But, you know, they're mandated and they have to do this contracting and subcontracting. These contracts are never made public. You don't know where your money's going, and it doesn't even go back to the community. And as far as making sure that the standards are there, they're not. They're virtually impossible to supervise. Now, I agree with the panel that, yes, we have to get rid of Harper and his lookalikes, but quite frankly, it's a lot more than that. It's not like a day after the election, if Harper's no longer Prime Minister, our work's over. Because quite frankly, all of the parties and all of the politicians are guilty. We have contracted out our democracy in this country. We are allowing politicians to run the country, and quite frankly, they're going to run it to serve their interests or their beliefs. We have to take control of our democracy. And you know, when they talk about no money, there was lots of money for the F-35 jets that they wanted. The money's there. But unfortunately, there is no political will to do that. The politicians appoint the judges. They make the laws, whether we agree with them or not. So it's really, unless we are willing to engage in civil disobedience, we're not going to get Medicare and a lot of our rights back. It's going to be a long struggle, and it's not going to be easy because, you know, I was in Oregon, and we're talking to one of the motel owners down there, and he said, we don't have elections in America, we have auctions, and we're becoming very much the same way.
I have a couple of questions. One of them is, where are the youth? How do we reach the youth? Many youth, many youth really don't realize what's going on because they've lived with, I guess I want to be careful using this word, but somewhat of a sense of entitlement. Medicare is everything they've ever known. And they're in many cases too young to have to need the healthcare system as much as some of us who are older. So how do we reach out and explain the history, how it came about, and really get the support from youth and educate youth around the importance of this? Because they're the ones that are going to really struggle later on if we don't fight for it. I have a lot of friends in the States, and I have seen how they struggle with paying for their health care. Most of my friends there have, the only health care coverage they have is called catastrophic health care. It costs $5,000 a year, and it's for catastrophes. And otherwise, they have to pay every time they go to the doctor. We don't want to be in that situation. We don't want private health care here. We have to fight it. I think it's really important for us to be willing to sacrifice a little bit and really get fired up about it. So, thank you.
I think it's absolutely critical that we not go out of here thinking, holy hell, things are really gone down the tube. The ship has left the dock. Where can I sign up to go knock on doors or whatever? And the world's coming to an end if you can convince me to go knock on doors. So, but I need the details. So I think we need to go out of here with some tools that empower us and get us in action.
The final phase of the campaign is the most important one because it's completely on our shoulders at that point, because that's the phase in which we defeat the Conservatives in the 2 North Island ridings. that is going to take a huge amount of work on behalf of a large number of people, phoning and talking to others. What we have found so far is that there is a lot of misinformation or just plain ignorance about what is happening to healthcare and what the Conservative program for healthcare is. It's a program of cuts and privatization and destruction of Medicare. So there's a sign-up sheet at the back of the room. Anybody that's willing to do anything, door-to-door canvassing, street corner, handing out flyers, talking to people, sitting in a mall, or phoning, please put your name on that list and we will contact you.
Barb's already talked about the specifics of what to do, but I'd also invite anyone who's not a member of the Council of Canadians to join us. We're nonpartisan, nonprofit, although we're really mad at a whole bunch of parties, so. But anyway, what can I tell you? And we're a movement, and we exist to serve our base, and that's a very different model than most organizations where they say, join us and we'll serve you kind of thing. Or you serve us. We see it very much the opposite, that we want to build an activist base. It's absolutely phenomenally important for the survival of our democracy. We're only as strong as our numbers. And the last thing I want to say about was about youth. We have to go where the youth are. I find with these kind of events, the young people don't tend to come out. They're either working 2 or 3 jobs, or they're going to school, or a combination of those things, and it's really important for us to go where they are. And I think part of the work that we collectively have to be doing is with youth. So thank you for that incredible reminder of how important it is that we reach across the generations. Thank you, and thank you all so much for coming out tonight.
Well, I learned there's a lot of more people concerned about this than we thought. I was really pleased that so many people from the Comox Valley came out. I learned that there's a lot more to this that we need to learn.
What is it? 90-some% are expect and want Medicare. It's like, I think most of us think it's a constitutional right now. And to have a government that is undermining it systematically is just not acceptable.
I think my adult children are going to vote in the next election. And this is very sad. You know, I certainly will be, but they feel like no matter what they do, whoever they vote for, it's not going to make any difference. So I'm working on that with them.
I think that they need to become informed. It's just so much easier to be watching Survivor or something else on TV rather than paying attention to the issues. So people need to be listening to organizations that are speaking for Medicare. They need to be talking to their friends and neighbors, and they need to be voting. They need to be letting our politicians know that it's important enough to us that we will vote for politicians, candidates who say that they're going to protect our health care. Pay attention to that at the polls.